Hello and welcome. Okay, so if you're expecting a baby or planning to be, you might have heard the name Parvovirus B19 come up. And honestly, it can sound pretty scary. But today, we're going to cut right through all the noise and give you a simple, clear guide to what it is, what the actual risks are, and here's the good part, how doctors are incredibly well equipped to handle it. All right, let's dive in.
Here's what we'll cover. First, we're going to demystify this virus, because you probably know it by another name. Then we'll talk about the specific risks during pregnancy. After that, we'll look at how you'd even know if you have it, what doctors do about it, and finally, we'll peek into the future of prevention. All right, so first up, what exactly is Parvovirus B19? Well, that scientific name sounds kind of serious. I bet you know it as something much, much more common. Does that ring a bell? You know that classic childhood thing where kids get a super bright red rash on their cheeks, like they've been lightly slapped? Yep, that's the one. Parvovirus B19 is just the virus that causes fifth disease. And why fifth? Well, it was literally the fifth illness on an old list of common childhood rashes, right after things you've definitely heard of, like measles. It is incredibly widespread, which brings us to our first and honestly most important piece of good news. Take a look at this number. This is probably the most reassuring fact we're going to talk about today. Because this virus is so common when we're kids, about 3/4 of all adult women have already had it. That means you're already immune. For the huge majority of expecting moms, Parvovirus B19 is just not a concern. Okay, so what about that other 25%? For the smaller group of women who haven't had it before and are susceptible, what does the risk really look like? So just to put that into a picture, here's what the population looks like. From here on out, all of our focus is on that smaller slice of the pie, that 1 in 4 women who could potentially get infected. For a woman who isn't immune, if she gets infected during her pregnancy, the virus can pass from her bloodstream across the placenta and to the fetus. In medicine, they call this vertical transmission. But even if a mom gets infected, it is not a guarantee the baby will be. The transmission rate is somewhere between about 1/3 and 1/2. And here's the next layer of reassurance. Even among the babies that do get infected, the vast, vast majority are totally fine. The infection just runs its course with no negative effects. So, in that very small handful of serious cases, what's actually happening? Well, the virus has a specific target. It attacks the cells in the bone marrow that are basically the little factories for making red blood cells. This can shut down production, which leads to severe anemia. That anemia can then cause the heart to struggle, leading to a serious buildup of fluid in the baby's body, a condition called hydrops fetalis. And this is really important. Timing is everything. The risk of a bad outcome is not the same all the way through a pregnancy. It's highest in the first trimester, and even then, we're talking about a 10% risk. After week 20, that risk of serious problems plummets to 1%, or even less. The baby just gets much stronger and more resilient as the pregnancy goes on. Okay, so knowing all that, how would you even know if you've been infected? Let's talk about what to look for and how doctors monitor things. So for pregnant women, the number one symptom is actually joint pain, maybe with a mild rash. But here's the crucial part. About 1/3 of women who get infected have no symptoms at all, 0. That's why if you know you've been exposed, like your kid comes home from daycare with those classic slapped cheeks, it's so important to call your doctor, even if you feel totally fine. And the process doctors follow is super clear and methodical. After you tell them about a potential exposure, they'll do a simple blood test. They're looking for 2 little flags: IgG antibodies, which say you've had this before, you're immune, and IgM antibodies, which say you have a recent infection. If that IgM comes back positive, nobody panics. They just start a very careful monitoring plan. And that monitoring is amazing. It's done with a safe, totally non-invasive technology. Using a special kind of ultrasound called a Doppler, they can measure how fast blood is flowing through an artery in the baby's brain. If the blood is flowing faster than it should be, it's a sign that it's thin, which is a very accurate indicator of anemia. This lets doctors spot a problem long before it becomes an emergency. And that early detection is everything, because even in those really rare cases where the baby does develop severe anemia, there is a life-saving treatment that works incredibly well. This quote right here really explains why that Doppler ultrasound is such a game changer. It's basically saying that by the time you can see the fluid buildup of hydrops on a regular ultrasound, the baby's red blood cell count is already critically low. The Doppler lets doctors see the anemia coming and act before things ever get to that point. So what is that action? Well, first, the Doppler finds that fast blood flow.
To be absolutely sure, a specialist can then take a direct sample of the baby's blood. And if severe anemia is confirmed, they can perform something called an intrauterine blood transfusion, or IUT, where they deliver healthy red blood cells right to the baby through the umbilical cord. And the impact of this procedure is just night and day. Look at this. For a baby who develops hydrops, this transfusion skyrockets the survival rate from around 55% to over 82%. It is truly a life-saving intervention.
So we have great ways to manage this, but what does the future hold? Could we prevent it from happening in the first place? Before we look ahead, let's just quickly recap the really crucial points to remember. 1. Most women are already protected. 2. Even if you get it, serious problems for the baby are rare. 3. We have excellent, safe ways to monitor for anemia. 4. There's an incredibly effective treatment if it's needed. And 5. For the overwhelming majority of babies, even those who needed that treatment, there are no long-term issues. Now, the one tool we don't have in our toolkit right now is a vaccine. There isn't one available today.
But that could be changing. As this research shows, scientists are working on brand new types of vaccines. They use these harmless little particles that just look like the virus to the immune system, training it to fight off the real thing. And the results are promising enough that they're ready to start testing them in people.
And that leaves us with a really hopeful final thought. While we have incredible tools today to manage Parvovirus B19, science is actively working toward a future where a simple vaccine could make this entire worry a thing of the past for expecting families. Thanks for joining us.